Okay, guys. So I hope you had a good break and that it was the opportunity for you to switch back to real English, real Spanish, real whatever you speak. But again, today it's a very special moment for me because I have the opportunity to lecture with this crazy bearded guy that I know from a long, long time because we started to work together in Alfort, as I said. And during the years when we were working together, we developed this combo thing where we do a dual presentation. So it's always a lot of fun to do this presentation with Aurélien. And I'm so glad he could make it to Canada for this event. So we're now going to speak a little bit on the practical approach of parturition, lactation, and the role of nutrition on these different phases of feline reproduction. And here in Canada, when I arrived in Canada, I learned something. English people, you guys love acronyms. I'm what they call, again, AKA, what else? The FYI, etc. I had to learn all those stuff. Very difficult for a French person. But, so they said, you're a TSV. I said, what the heck is that? Rick is a SSV, so even in the different subsidiaries, we don't have the same name. But I'm what we call technical service veterinarian. And that's what I explained you a little bit about my work yesterday. I'm answering questions from our clients, from our breeders, from our veterinarians client, and we get lots of these questions on what should we do during pregnancy, or should we feed a pregnant queen, or what should we do to improve the milk quality. So the goal of this presentation is today, this morning, will be to give you an overview of what, again, you guys can do to improve what you're doing in your cattery, or to optimize what you're doing in the fertility process and the parturition process, etc. So this is the plan of the day, and we touch on mating and gestation. Now we are moving towards whelping and lactation. And when it comes to parturition, a few years ago I did a talk in France. Well, in fact, it was not a few years ago, it was 10 years ago. In fact, it was a talk to breeders, and I had this little South Park character on the first slide, which was, well, it's hard to do with the mic in fact, but he was like that, oh, I'm a breeder, my queen is going to give birth, I'm stressed. And that's something I was telling to all our vet students. When you deal with parturition, in queens, in ducks, they are a polytopus species. They have several kittens, they're expecting several kittens. You can never say for sure everything will go right, everything will be fine. It's impossible. Sometimes, some of my colleagues will say, oh, cats, everything will be fine, no worries. And that could be, I mean, when we were doing C-section, remember, when we were doing 100 C-section in dogs, maybe we will do 1, 2 in cats. It's not common. However, you guys are predisposed. You know that unfortunately, you might face those difficult situations. So you're stressed, you're anxious, you're worried. And this is a table I like to share with newbie breeders. I'm not sure if we can say newbie breeders, but let's say we can say that. When people start breeding, I told you yesterday, or I'm not sure if I told you, but in France, Aurélien and I, we were involved in a course. Everybody who wants to start breeding, they have to go through a 3-day course where they will listen to the two of us, not at the same time, luckily, discussing about feline reproduction, infectious diseases, genetics, nutrition, behavior. Basic things everybody should know before breeding cats. Because many people today, they're just like, oh, I take a female and a male Persian, I will put them together, I will have lots of kittens. 1 kitten equals this amount of thousands of dollars, and with 1 liter we will be able to buy a car. That's the basic things. But they don't know that, and that's why I think these courses were important to show them that it's not easy. And I love to show them that because many people didn't really know how to approach parturition. Even vet students, you know, today, many of them, they've never seen a queen delivering. So we won't describe this or everything. The first line is always funny because 24 hours later starts 24 hours after temperature drop. This is something we do in dogs. We can do it in cat, but taking the temperature in a cat can be quite challenging sometimes, especially in certain queens. So, but it gives guidelines. But you know that there are huge variabilities. Maybe if I was asking you a question here, you would tell me, oh, but I had a queen who took more than 8 hours to deliver the full litter, and all the kittens were healthy. I personally had a client that told me that her queen delivered in 3 days, and all the kittens were healthy. That's not uncommon in the breeding world. So you will learn from your experiences. You will learn as you go. And that's important to keep in mind. When you're stressed out, when you wonder what's going on, you can go to your vet, you can discuss with your vet, and that's something we're going to discuss here. But Aurélien, there are different factors influencing the well-being and the survival of kittens, I think. So can you tell us a little bit more about that?
Yes, of course. So I'm going to try to describe with you something important. I mean, if there is some stillborn kitten, I can tell you, Manu, that it's not infectious disease. In fact, if we take this study,
sure
yeah, look at that. If you take this study, for example, in 274 kittens stillborn, they try to evaluate the percentage of kittens dead and different period of time. Okay, perinatal, neonatal, pre-weaning periods. And for each of these kittens dead, try to see if it's infectious disease, congenital problem, nutritional one, or other problem. And what we can observe is during the prenatal period, you can see there is no infectious disease. Okay, so in this kind of situation, no infectious disease. And infectious disease arrive after 1 or 2 days because you need to have this multiplication of pathogen. So at the beginning, it's not linked to this. It's mainly linked to dystocia. And when we continue to observe this, we can see that during the pre-weaning time, same thing, and post-weaning, also half of the cause are infectious disease. But at the true beginning, during the few hours post-whelping, the stillborn and neonatal mortality during the few hours post-waiting are not infectious disease. So it's another cause, and mainly dystocia. So Manu, can you give me more information on it?
Are you sure I have enough time to talk on dystocia today?
You like to talk, so go.
Well, I am very talkative, you're right. But Aurélien is right. Dystocia severely impacts the neonatal survival rate. And you can see here on this slide, as we said before, dystocia is not something so common in cats, and maybe this is, if you ever dealt with dogs in the past, maybe this is something you know. Difficulties to give birth are not common in cats. You see here, around 8%. I think we had another study in the past, you know, who said it was 0.4%. So it's not common. However, purebred cats are overrepresented. This is something we were mainly seeing in purebred cats for different reasons, morphological reasons, etc. We'll touch a little bit on that. But what happens is that when you have a difficult parturition in queens, this leads to a phenomenon we call metabolic acidosis. We have a fetal distress. Imagine the embryo. The embryo is no more an embryo, it's a fetus. The fetus, which is about to be expelled from the uterus. But it takes time. So the placenta is detached. And they're not receiving the oxygen through this placenta. So they are kind of in apnea for a while. So this leads to what we call hypoxia. There's not enough oxygen reaching the different tissues. And then we'll see newborn kittens that are weak, newborn kittens that are maybe struggling to breathe. Maybe you already saw that, kittens that are trying to swallow air, just because of this metabolic acidosis that's going on. And then, we're not going to discuss this too much, because then the guy at the back will kill me, but I know. But this has consequences on the health of the kitten afterwards. So depending on what happens during parturition, this can impact the neonatal mortality. And there are so many factors already. I'm a little bit confused. If you can give me some heads up on that.
Yeah, I think the important point is to prevent this kind of problem. So I propose to you to see some of the most important causes. As you can see here, there is an effect of age, of the litter size, of the body condition score, and of stress, and some medication also. So I propose to see with you the three main ones, and try to see the scientific publication on this topic, and to try to decrease the risk of dystocia and so of stillborn puppies, kittens, sorry. So, what's happened? Let's start with litter size, and to see that, I would like to present you a studies published in 2009 on these risk factors. So what we can observe here in these studies, here you have the proportion of dystocia, and you have the litter size just under, from 1 kitten until 9 kitten in the litters. We can see two risks. The first risk is when you have only 1 kitten, and we can observe also an increased risk of dystocia over 7 kittens in the litter. So Manu, can you tell us why there is these two things?
That's something I can definitely explain. When you have a small litter, in dogs it's described as the single puppy syndrome, and we can even think of the single kitten syndrome. Keep in mind that the kittens, when they are ready to be expelled from the womb of their mother, they will send a signal telling the mother, I'm ready, I can get up. But we think that when we're dealing with small litters, we think that the signal is not strong enough to induce parturition. So what happens is that you have this kitten which is not exposed because the signal that leads to parturition isn't strong enough, and the kitten is growing, but at a certain point, the placenta is not able to properly feed this kitten. So then the kitten dies in utero, unfortunately. On the other hand, when you have large litters, this is a phenomenon we call hyperfetation. You have lots of kittens, the uterus is overstretched. Uterus, Aurélien is going to touch on that, contains a muscle, and it's not able to contract properly. So we end up with weakened uterine contractions, and again, difficulties to give birth, which lead to this increase in neonatal mortality rate. Does that answer your question, my friend?
Perfect, good to know. So let's continue with another factors. And now it's on stillborn kitten. And as you can see in this study, it's quite the same thing. We have here the stillborn kitten, okay, the proportion of stillborn, and the litter size. And we can observe that there is a higher risk of stillborn kitten over 7 kittens in the litter. Manu,
and here's the same thing. Yep, same thing again. We have a huge litter size because it takes longer time to expulse them. They don't receive enough oxygen. They suffer from this metabolic acidosis. And then when they're out, that's why we deal with more stillborns, because maybe they die in utero during the delivery process. Exactly the same thing we said before.
So I think it's important to underline that, okay, we have 1 kitten, we can do nothing with this. We cannot deal with this because we are not responsible to have only 1. But something which is interesting to know is frequently we can make some information with ultrasonography, X-ray to determine how much there is, how much kitten you have in the litter, and to define if this queen is at risk or not. And sometimes it can give information to follow the queen and to say, okay, nothing happened. Maybe it's because there is only 1 kitten, and we try to manage the well-being. So it's thanks to ultrasonography or X-ray, you can predict the risk and to be very careful with this queen compared to another, for example, with a 3 or 4 kittens in the litter. So another factor is the age of the queen, and I think it's something which is very important also to take into account. And in these same studies, they evaluate the proportion of stillborn kitten and the age of the queen. We can observe two things. At the beginning, between 1 and 4 years of age in these studies, the proportion of stillborn kitten is quite low, but queen between 5 and 7 years, you can increase the risk of stillborn kitten, and over 8 years, of course, the risk increases a lot, and you can observe a very high level of stillborn kitten. So Manu, can you explain why? What's happened?
Again, as you said, this is a question we get quite often. Many breeders are asking us from time to time, when should we stop breeding a queen? And this gives you kind of an explanation. Because what happens sometimes, when the queen gets older, the uterus gets older too. So we have infiltration, the uterine contraction just gets weaker and weaker. So because of that, this explains you why when the queen ages, we have an increase in neonatal mortality again. So just because the uterus is not able to contract properly anymore to expose the queens.
And there is one more point which is important to underline, it's the fertility of this queen. And we can observe in these studies that until 6 years of age, the fertility is quite similar. However, when the queen becomes older, in this case, we decrease the fertility. Okay, the number of fetuses, of kittens, decrease with age after 6 years of age. So Manu, why?
When aging occurs in our queens, the capacity of ovulation decreases. So we have less oocytes that reaches full maturity. We have less oocytes that are ovulated, and those that are ovulated, maybe their quality will be compromised. So that's something we observe, and that's well described in different species, and that we suspect in cats as well.
So another factor, and Manu explained you a little bit this factor, is the body condition score of the queen, which is something very important also for the risk of dystocia. And I just would like to underline some key points on this. If you have an overweight cat, in this situation, the fat produced by the overfeeding can go in the muscle. And something which is important is to underline that uterus there is a specific muscle in uterus which is myometra, and this myometra is responsible for the expulsion of kittens. Okay, so if there is an accumulation of fat in this muscle, we can decrease the contraction of uterus, and you can decrease the strength and amplitude of contraction. Let me explain. In human medicine, they try to see amplitude of uterus contraction depending of the body condition score of women, and we can see that amplitude of contraction are higher in normal weight women compared to obese one, and so the amplitude decrease due to this accumulation of fat inside uterus. Another thing which happens is the frequency of contraction. You can see that the frequency decrease when the body condition score increase. So you decrease the frequency and you decrease also amplitude of contraction. So you increase the risk of dystocia in this situation. And this situation is well described in human medicine. As you can see here, the proportion of C-section depending on the body condition score in women, and we observe an increased risk of dystocia in case of high body condition score due to this accumulation of fat inside the uterus. So it's not yet demonstrated in cat, but we can suspect the same problem in overweight queen.
And again, this morning I was telling you about the way you feed your queens is extremely important, and pay attention to free feeding. You know your animals, you know which one tend to swallow all the kibbles in 10 seconds, etc. Really focus on that, because this is something I see very often in breeding catteries. They are free-fed, which is not bad because some of them can regulate themselves, but some individuals cannot. And if they don't regulate themselves well, you will end up with this increase in body score condition that can impact the parturition and the fertility, if you remember my first talk. And Aurélien, I think one thing we can tell them is about how to deal with the dystocia, because now you know what you can do to prevent it. But I told you guys, you're predisposed, unfortunately, to see those kind of things happen. And if this happened, what happened, Justin?
Just a question, is there any indications on a queen that's too skinny?
Yeah.
Ah, that's a very good one. Okay, sorry. Yeah, somebody put here, répétez les questions s'il vous plaît, repeat the questions, and that's my, I forget. So the question of Justin was, what happens if a queen is too skinny? Do you want to answer that, Laurie?
I can begin to answer.
Oh, I will finish the answer then. Are you okay with that? We'll do that. Okay.
It's a question of also energy. So if the queen is very thin, there is not enough energy to optimal contraction. So you can obtain the same risk, because you can increase the risk of hypocalcemia, hypoglycemia, and so finally the well-being is not optimal neither. So and moreover, after you have some kind of problem with for the lactation, we will see that after. So it's a real problem also. I mean, too thin, it's not good for lactation and well-being also. So that's why it's really important to be in optimal condition. Overweight is not good, but too thin, it's not good neither.
And moreover, if you remember the study from this guy from China, Zhang et al. 2000, I don't remember what, they in fact measure the strength of the uterine contractions in overweight individuals and in skinnier individuals. And they realized that in the two different categories, Aurélien showed you what happened in overweighted conditions, but in skinnier conditions, we deal with spastic contraction. Rick, is it okay, the pronunciation?
Yeah.
Spastic. So you have an increased frequency of contractions, which then leads to non-proper uterine contraction and expulsion. So both can be problematic. Yes.
Do you consider the number of previous litters of that queen in relation to the dystocia?
So the question is, do we consider the number of previous litters when we focus on the risk of dystocia, correct? I can answer that, but I don't know if you want to add something. I definitely think so, because the more liters the queen had, be aware that the placenta is deeply anchored in the uterus. Each time the placenta is detaching, it leads to small lesions. So these small lesions are bleeding, and eventually they can become fibrotic. So the more parturitions occur, the more these kind of lesions we can deal with, and potentially the less strong the contractions will be. That's again just a guess, because the uterus is a fantastic organ. When we were doing biotechnologies together, I remember we were doing surgeries, C-sections on individuals, and 15 days after, we were doing another surgery to collect the uterus or the oocytes, etc., the ovaries, etc. 15 days after, it was totally healed most of the time. So it really depends on the individual, but that could indeed impact the parturition process. But let's go back to the dystocia, because this is the funny part of it. Well, not the funny part. I told you, yeah, that's not the funny part, but...
You're just so
Interesting.
no.
There's only a man could say that.
Yeah, sure. But what I want to say, well, I told you every year I go to the vet schools, and I do talks on clinical cases on canine and feline repro. Should I be afraid of breeders? What I did last year was about neonatology. And I was telling students how to do obstetrics, and I was telling students how to deal with this. So to teach them how to approach those cases. What I tell you, and what I can tell you is that if you have any doubts, if you think something goes wrong, I would definitely encourage you to go to see your vet. And do you know what this is? Do you have, yes, that's a molecule. That's a very good point. But which molecule? Which molecule can this be? Because we're speaking about parturition. I give you a hint. No, it's not progesterone. Much more complex than progesterone.
DNA.
It's not DNA. Oxytocin. Have you heard about oxytocin? Oxytocin. Ah, Rick. Oxytocin. Do you have oxytocin at home? Who says yes?
Yes.
Lynn? Bazooka? That's something we always say. And I'm going to explain you why. Oxytocin, I said bazooka because usually we ask who has oxytocin, and if you say yes, Lynn has a bazooka we use during our presentation, and that's why some breeders are missing from the previous presentation. But why am I telling you that? Let me explain. Oxytocin is a drug that is indeed used to induce uterine contractions, and that is used to deal with difficulties to give birth in humans, in dogs, in cats. So very good product. However, when it's not used properly, it can lead to severe mistakes and severe issues. When I was in France, I was doing sometimes emergency consultations in a vet clinic in Vincennes, in Paris. And one night, they brought me a queen. It was a little bitch, but the same could have happened in a queen. And this was a small Yorkie. And this small Yorkie, the owner said, oh, they have some difficulties. She has some difficulties to give birth. Can you help? Well, sure, we can help. So bring her in. And when she put the bitch on the table, there was something pink hanging from the vulva of this bitch. And I was like, okay, I'm not wide awake, because it was, keep in mind, bitches and queens, all of them give birth between 2 and 3 a.m. 2/3 of them, just to make your life easier. But there was this pink thing hanging on. I was like, okay, that's weird. That shouldn't be there. This was the intestines of the puppy, because the puppy was in wrong presentation. They used oxytocin all day before to try to expose the puppy, but because of this wrong position, they couldn't. So the bitch the bitch pushed, pushed, pushed. Nothing was getting out. And in the end, it just broke the puppy into 2 pieces, and that's what I could see. And that, to tell you the truth, was the best thing that could happen. Because worst case scenario, we will have to deal with a uterine rupture. And I'm sure some of you attended to C-sections. The uterus is a highly vascularized organ. So when it breaks, when it ruptures, it bleeds like hell. And they could have lost the puppy and the bitch. Same thing can occur with oxytocin. And today, oxytocin was used a lot in the pig industry in the past because they wanted the sow to give birth during daylight, because that was the best way to optimize neonatal survival in this species. In dogs and cats, in the pig industries, they moved away from the use of oxytocin because they realized that when they use it, sometimes they modify the pattern of the uterine contractions, and eventually, in certain cases, they can increase the neonatal mortality. So there are lots of different protocols, and that's why I think when you use it blindly, you can do big mistakes. So that's why I definitely don't encourage you to have oxytocin at home. And I personally think it should be used only under veterinary supervision. And if you want to give them something during parturition, give them calcium, calcium gluconate. Calcium is the fuel of the muscular contraction. During parturition, all these queens, they have an induced hypocalcemia because they are panting, apparently it hurts, but don't understand why, but anyway. It's very risky to say that in an assembly full of women. What I mean is that...
Your life is in danger.
Yep, I know. Every day. But what I mean is that calcium will eventually stimulate, by giving them calcium, oral calcium, during parturition, not before, just during parturition, you can increase eventually the strength of those uterine contractions. And the good thing with oral calcium is that the metabolic system that regulates the calcemia in dogs and cats is highly structured. So you cannot overdose it when you give it orally. Don't give it IV. I know some breeders like to put IV catheters, etc. Don't give it IV, that's a big risk because it can lead to cardiac failure. Cardiac failure. Cardiac failure. Cardiac.
You answered the question.
Okay.
How much calcium would we get?
The question is how much calcium do we give? The good thing is that you cannot usually overdose it. The recommendations we had in the past were 1 to 5 milliliters per animal every 30 minutes. Or one of my colleagues in Germany, she used 0.3 milliliters per kilo. But we used gluconate, calcium gluconate. And that's again is something that can be used, and that's not as dangerous as oxytocin. With oxytocin, you can have consequences. So that's what we don't recommend.
Sometimes I recommend when the clients call me to massage the nipples of the queen. That stimulates the oxytocin network.
Yep. The question is, if we stimulate the nipples of the queen, does it increase the oxytocin secretion? That does indeed. Oxytocin is the hormone of the milk letdown. So if you massage the nipples, it can eventually increase the oxytocin secretion, and that can help because it's naturally regulated somehow. So that could be a possibility for sure. And that's why when you have kittens, we do recommend to put them on the nipples. Rick, you want to say something?
I just want to say in the United States we have a paste with calcium in it, and that does a very good job, and that way you don't have dogs spitting out the liquid.
What is it?
It's a paste, it's called Calsorb.
And where do we get that?
I don't know if you can get it. It's
Calsorb?
Calsorb.
That's good to know because in Canada I'm not sure we have something similar.
CALSORB.
But again,
just one point to underline, we need to do this only during the whelping. You mustn't give calcium before with a normal dedicated diet for pregnancy. You mustn't give add calcium, neither for cat, neither for dog, because you will induce, in this case, hypocalcemia. So it's only during the whelping that you can do this.
That's extremely important. Thank you for adding that.
Doesn't that cause eclampsia? Could that cause eclampsia?
The question is, could that cause eclampsia? Yes, it can. It's a paradoxal reaction. But if we want, we can cover that later. just few things I wanted to add. Today we have ways to evaluate at the vet clinic what's going on. We can do ultrasounds where we will check the heartbeats of your kittens, and if it's above 160, 200 beats per minute, we know that everything is fine, and we have time. We have time to define the best approach to deal with these difficulties to give birth. 10 minutes? We can do ultrasounds, X-rays, to see if there's a malposition. You see here, in this queen, if we see that, we know that there's no way to use oxytocin. This is an indication for C-section. This is a transverse presentation. If we see that on the X-rays during parturition, this is a case where we need to do a C-section. So the kittens are out, and what do you think of that? I will go quickly on that because I think she's swinging. No, we don't do that anymore. And I'm showing you that because this is something I learned at the vet school. This is something we started doing 40 years ago. When Rick was around, I'm sure this is something we learned at the vet school. But no, I mean, that's true. This is something we learned. And recently we had several publications showing that when we do that, we induce lesions in the brain of the animals that are increasing the risk of neurological symptoms later in their life. So this can easily be avoided. We have different things we can use. I'm a big fan of the suction that you can use to aspirate the oral content, the liquid content in these newborn kittens. And that's really something that is important to do, because if the liquid accumulates, it can go into the lung and increase the risk of bronchopneumonia. And I'm a big fan of what we call sopalin in French, that you call
Scott towel.
towel.
Scott towel.
Scott towel? That's how you call it? Okay.
Sopalin, c'est Scott towel.
But this tissue that you can use to massage,
Paper towel.
paper towel.
towels.
You see, that's good. It's a good exchange. I'm learning English at the same time. But I think it's just this, just massaging the thorax of the puppy, the kittens will help them breathe properly. And keep in mind that when we were doing that, we were dealing with individuals after C-section, and they received anesthesia, so they were hard to resuscitate. In your case, you're dealing usually with normal parturitions, much easier. Just by doing that, we have many different ways, but just by doing things like that, you can improve their survival. And there's one important step. When the kittens are out, you did the neonatal resuscitation thing, there's one thing you should do. It's open their mouth. As you can see that. These are pictures in Abyssinian kittens. And you can see here the most common neonatal defect we see in dogs and cats, cleft palates. So this cleft palate is a communication between the oral cavity and the respiratory tract. When these kittens suckle, the milk goes straight into their lung, and then they develop eventually bronchopneumonia, and they can die from it. So there are different symptoms. You will see milk coming out of their nostrils. But this is something you need to do. When the kitten is born, open its mouth. It's not that common in kittens, but we can deal with, we can see it. We can treat that today. We have medical treatments. We can do a surgery. But to do the surgery, we need to wait for a while. Usually the surgery, when I was at the vet school, we were recommending to do it 2.5 months after birth. Many of my colleagues today in surgery, they recommend to wait 6 months, 14 months before doing the surgery, just because we have more material to fix it. But that can be done. We can save kittens this way. The only thing you need to be aware of is, are you ready to cope with the challenge? Yeah. Because it's time consuming. These kittens, you will need to tube feed them during the first 3 weeks of life. 3 weeks of life, first week, 8 meals per day, something like that. Very challenging. You need to be up to the challenge. If you're not, I would say that it's better to put them to sleep for the simple fact that you're going to struggle and they're going to suffer, and we don't want that. Can be done, but it's challenging. And in the future, they do something fantastic today. They have palatal prosthesis that will develop in puppies. But you can see it here. This is something that that might become available for animals in the future. It's like, it's
a retainer.
Yeah, exactly.
Orthodontics. Yes.
So these things, we can put them and close the cleft palate, and then they can suckle the queen totally normally. So that would be a nice alternative because it will make it much easier to deal with. But today it's not available on the veterinary market. But some research scientists did this. And we have a little question from Aurélien. Oh, I have to read the question? Oh, you're so bad with me. Cleft palate, can it be linked to a genetic predisposition, a low level of some nutrients, a treatment during gestation, or all of the above? Okay, let's see what you guys answered. Ah, you don't want to show me the answers. No. Anyway, the good answer was all of the above, as you could imagine. And I will let Aurélien explain you one.
I'm going to speak a little bit about dog and human medicine one more time because it's a pity, but there is not a lot of studies in cat. But I'm going to try to answer to this question. In dog, frequently this cleft palate can happen in all breeds, but it's true that there is a predisposition of brachycephal breed. So it's a frequent problem in this breed with a brachycephal phase. And so a question for you, if it's work, which nutrient is important for the prevention of this kind of problem? Is it vitamin B12 with cobalamin, vitamin B9 with folic acid, beta-carotene, or calcium? From your point of view? Okay, I see between calcium and vitamin B9, folic acid. So the answer is this one. In fact, there is a lot of studies now in human medicine, for example, which shows that folic acid prevents this kind of problem. So now there is a lot of these different studies, prospective, retrospective studies showing that when you give folic acid in human medicine, in women, in this case, you improve, you decrease the risk of this cleft palate problem. Okay, so now there is a lot of different publications. And
Do you know what the percentages are lately with cleft palates born with humans? I know back in the 1990s, I think the latest study was like 1 out of 700 children were being born with clefts.
in fact, there is a lot of different percentage depending on the countries and depending of if they were supplemented or not, and depending on the nutrition of this women. So, but it's something like this, but with a huge difference depending on the countries also. Yeah. In dog and cat, we have not a clear idea of the frequency of this. So, the first question that we wanted to answer in dog and cat is, when we give a supplement of folic acid, do you have this increase of folic acid in the blood? Because it's a necessity to have an increase to prevent this problem. And for this, there is a study just published last year. And in this publication, they evaluate two things. Two group of dogs. In black, not supplemented, in black with supplementation, and in green without supplementation. And they give this at the beginning of it, 2 weeks later and 30 weeks later, they evaluate the concentration of folic acid in these pitches. And what we can observe at the beginning, there is no difference between the two groups. But when you give a higher level of folic acid, you increase the level of folic acid in this population of dogs. So, first step, but the second step is, when you increase this level, do you decrease in dog and cat the frequency of cleft palate? And this was evaluated in a specific breed, Boston Terrier. In this study, they evaluated 242 puppies, and they evaluated the frequency of cleft palate in two groups. Control one, without supplementation of folic acid, and the second one supplemented with 5 milligrams per day per dog of folic acid since the beginning of it until the end of gestation. And in these studies, what we can observe is when you supplement pitches with folic acid, you decrease the frequency of cleft palate in this population. So, in this kind of population, it's the same thing as in human medicine. When you increase the volume, the concentration of folic acid, you decrease the frequency of cleft palate. So it's a good way to prevent the risk of cleft palate. However, folic acid is not everything. First thing to underline is there is some drug which can induce cleft palate. It's the case, for example, with corticosteroid. Okay? So in this situation, if you give some anti-inflammatory drugs, you can induce some cleft palate. So first of all, when you think that your queen is pregnant, give this information to your vet, because in this situation, it's going not maybe to treat if there is a problem as the same way as if she's not pregnant. So this is the first point. And in dog, one more time, sorry for this. There is some publication, showing that there is a genetic risk, a genetic predisposition of cleft palate in this population of dogs. So, folic acid is one point for the prevention, but it's not everything. Drugs and selection can also play a role. So, you can decrease with folic acid, but if there is still a problem, thanks to these two other points.
What else? And one thing, and that would be the perfect transition to Rick's presentation, but one thing we would really recommend you to have in your maternity is a scale. If there's one thing you should buy a scale, because that's the best way to monitor the health of the kitten. And I think we can go very briefly, because the birth weight of the kitten can be impacted by different factors. I know we're going to, but
You're stepping on my toes.
I'm not stepping on your toes, because this is before they are even born. And Aurélien is going to show you what are the different factors that can impact the birth weight in these kittens before they were even born.
Rick is going to kill us, but just to underline this, it's true that we are not going to speak after, but when they arrive, okay? And after Rick is going to continue after when they are born. So to finish this part, what's impact the birth weight? And Rick explained impact later for the survival chance. There is three main points on birth weight. It's the breed effect of the breed, litter size, and gestation length. What's happened with the breed? As you know, there is difference between breeds in the kitten birth weight. And if we take Burmese as reference, we can observe that in large queen, like Maine Coon, you have a birth weight which is higher, like in British Shorthair and other breed. And at the opposite, in small queen breed, like Koran, we have a lower birth weight. So of course we have an effect of breed size. What's happened about gestation length? And first of all, we can observe also some difference in the duration of the gestation depending on the breed. So it's something which is described. But for our topic, what we can observe is whatever the size of the breed, we can observe that when the gestation length increase, we can see that the kitten birth weight increase around 1.5 grams per day of gestation more. Okay? So when the gestation length increase, the birth weight also increase. And the litter size effect, it's the opposite. We can see that when the number of kittens per litter increase, we can see that whatever the breed size, we decrease the birth weight of the kitten. So in this situation, more there is kitten, lower they are at birth. Okay, and now Rick, continue with impact of this birth weight.